Hi, my name is Lydia Mate, and I'm SEMA'S Country Director in Uganda. SEMA is a Swahili word for speak, and at SEMA we gather citizens' voices with the aim of improving public service delivery. Please do allow me to tell you how SEMA has been holding public services accountable during the COVID-19 pandemic. But first, the problem is that many citizens rely on public services that are most times inefficient, and also citizens do not have a way of giving feedback when they visit these public services. And on the other side, government finds it hard to collect data that is meaningful and reliable, and they have no way of comparing data over time and therefore cannot make improvements. SEMA's solution is quite simple. SEMA gathers feedback from citizens using various techniques. One, we've got in-person interviews using trained data collectors who are able to gather feedback from citizens at a time that matters the most after they've had an interaction with a public service facility. They are then able to have one-on-one interviews, take this information and feed it to our data team. We've also got smiley face feedback devices that are put at the exit of this station. These devices are made out of recycled plastics here in Uganda, and citizens are able to give their rating on a scale of very bad to very good. We've also got at distance survey techniques, for example, USSD codes and toll-free lines. And also citizens are able to use these techniques if they do not feel comfortable speaking to the trained data collectors. So what happens next? When this data is collected, SEMA is able to analyze this data and present it to these local offices on a monthly basis using customized reports. This way, these offices are able to know how they're performing. Did I do very good or did I do very bad? And then we are able to observe and measure improvements at these offices. Because of this, we are able to track the data and in turn improve public service delivery. So our theory of change is quite simple. When we gather feedback, we are able to do monthly reports, and in turn, we are able to observe improvements at these offices. And in turn, we've been able to see better public service delivery in Uganda. We've been able to reach out to over 93,000 citizens, and of which 80% of the waiting time has greatly reduced at these institutions where we measure feedback. And we have also seen 67% of these institutions improve their service delivery. During the pandemic, there was a great impact on Ugandan citizens. One, citizens were not able to access basic facilities, and there were lots of travel bureaucracies. Imagine a local citizen having to go to the resident district commissioner to seek a travel permit to go to hospital to give birth. This made it very hard for citizens. And of course, in turn, many services became inaccessible to citizens, and many offices were closed down. Thirdly, very many citizens' voices were not gathered before laws were made. There were no consultations, and therefore the laws which were being made were very hard on the citizens of Uganda. During the during the COVID-19 lockdown, SEMA did not stop working. We published a service needs assessment. We were able to gather feedback from different citizens to find out what services they needed most, what was hard for them, and what needed to be done. With this information, we're able to pass this information to the head of the COVID task force, who used this information in determining what services needed to be done and what restrictions needed to be eased up. We were able to release 3 trend reports for the police and healthcare facilities. We also convened civic leadership meeting with members of the parliament, information authorities, and the police to discuss various issues that affected the citizens during this time. So what's next? SEMA will be able to spread out to various regions in Uganda this year, and also SEMA will go regional, will be at Kenya, and also we've been able to do our first private sector sales, and we believe SEMA continues to grow. Thank you very much for taking time to listen to what SEMA does.